So crowns in one day. Tell me about that.
This is an amazing technique that we have. We used to do this process where we would go ahead and use a goopy, unpleasant material that would make some people gag.
The impression stuff.
The impression material.
Terrible.
I had very few fans of that, trust me. So, and then we used to take that impression, send it out to a laboratory with as detailed instructions as we possibly could, and hope and pray that what came back would, number one, fit beautifully, and number two, look the way we wanted it to. And that was usually the case, but not always. And there was a 2-week wait. If it didn't come back perfectly, and I mean really the way we wanted it, we'd have to send it back for another 2-week wait. So now the patient's waiting up to 4 weeks, sometimes even more. With the way technology has advanced now, what we do is, it's really, really nice. We use this like a wand. It's a camera. And we take a digital picture of the teeth that goes into a computer and makes a virtual model. So there's no goopy material. We just take pictures of your teeth. It comes up on a computer screen. We design it right then and there. We have our own in-house laboratory and laboratory technician. The man is an artist, amazing work that he turns out. And he'll design it right there in minutes. And once it's approved, the actual result on the computer, then we send it to our mill, also in our office. And the whole process can take as little as an hour to an hour and a half.
Okay.
So for patients, a couple different ways that this is really, truly beneficial. Emergency patients. How about if somebody broke a front tooth and they need to have a cap done and they're in from out of town? We can give them a final crown that day, okay? We also have patients that are very nervous. Many of our patients do sedation, and we have 4 different levels of sedation. So if they're sedated, we don't want to have more sedation visits than are necessary. So when we start the procedure, they're sedated, we get the preparation done for the tooth that needs a crown, send it to our mill, have it completed, same day, same sedation visit, boom, the crown goes in and they're done. They don't have to come back.
Now, the fact that you have your own lab, are you a little bit less expensive than a traditional crown elsewhere?
We charge no more for all this different type of service and technology that we have.
Okay, so you do it all right there. I mean, whether it's wisdom teeth or root canals, I mean, you guys do everything right there.
Pretty much close to everything.